Hi, everyone. I'm taking my mask off because we're being socially distanced here. And again, thanks to Jean, it was a great presentation. And I'm following with a more difficult topic, trauma. So I know when we talk about trauma, it's very subjective. And I think that's one thing I've learned when I've done this in person with groups. I a lot of times see a lot of tears, and I see people getting very emotional because when you talk about trauma, it brings certain feelings to the surface. And I think the one thing, trauma is an event or series of events or set of circumstances experienced by an individual that is perceived as physically and or emotionally or life-threatening. And I think the one key takeaway is a lot of people don't realize that trauma is very subjective. What one person experiences, another person may not. So I think sometimes we tend to minimize trauma that maybe somebody saw their dog be hit by a car and the person's not a dog lover and they compare it to what they've gone through. So it's really important to remember that it's very subjective. There's different types of trauma. There's acute trauma, and that can be related to a single event, such as a car accident, a death of a spouse, a natural disaster. Using a car accident as an example, it may really change how you react. I know a friend of mine that hit a deer, and to this day, she's hyper alert to whenever she sees a deer because the deer almost fell into her car. So, again, that's very subjective to her. Chronic trauma is really occurs on a continuum, something like child neglect or abuse, where it goes on. It's not a one-time situation. Being affected by war, sexual abuse that is ongoing or occurred for a long period of time. And the most difficult to treat is complex trauma. It's a combination of acute and chronic. It may be that you were a child abuse survivor or a domestic violence survivor, and you were also raped as an adult. That would be very hard, obviously. So I'm also going to invite you, if you have any questions, to go into the chat. I'll be checking that periodically as well. And if not, we'll cover that at the end. So what can lead to trauma? A specific event. We know that school violence has been an epidemic in our country. And I think if you're experiencing it direct hand or secondarily, just through seeing it on the news or a relative or a loved one experienced it, that may be trauma for you. I think it's trauma for all of us. I think we all couldn't acknowledge that COVID is traumatic. No matter what your beliefs may be, it's altered our life, maybe irrevocably in some ways. Some people think that we'll be wearing a mask for a very long time. And every time we think it's getting better, we've had setbacks. So that is certainly trauma. As we talked about earlier, a series of events where you have prolonged exposure to traumatic situations, child abuse, sexual abuse, domestic violence. Absence of the good in your life. If your life has no good or what you can see as good can also be affected. Adverse childhood experiences, otherwise known as ACEs. We also know that there are racial, cultural, ethnic oppression in our country. And if you are part of those groups, what you've experienced may be traumatic for you, and that would be certainly ongoing. Natural disasters as well as man-made disasters. I often go back to September 11th. I can to this day remember where I was, and I think many of us of my age or even younger can really remember that. And that's something every time they commemorate September 11th, it's an emotional day for me. Poverty. We know that poverty impacts us in a number of ways. We don't have access to good health care. We don't have access to good nutrition. We may not have access to stable housing. Those are basic needs. So when we talk about poverty, it's not just being poor, it's all that it represents. Also community violence. We've seen that through our election. We've seen some violence in the community pre and post, and it's continuing. That impacts us. We've seen community violence around racial lines and what people perceive as, and what I believe is very real, is racism in our country. So those are all factors that can impact us. We all can react differently. So when a traumatic event occurs or has occurred in our life, because sometimes we never get rid of that trauma, and something may trigger that, and we can react differently. Some people with complex trauma, it take really much longer for them to manage it. Do we ever get over trauma? I think there's a subjective answer to that. It's always going to be part of our life. Sometimes when there's complex trauma and we can't move forward, that's when really treatment, counseling is really recommended. And other people don't experience the same traumatic response or symptoms the same way. They don't require treatment. And I think it really depends on a person's unique experience and personal circumstances. I think we all would agree that some people are more anxious than others. That's not a judgment. It's just a fact of who we are. Some people may be more resilient and some people are able to let things go. I do believe that's very much gender biased, where, I think men can let things go a little bit easier. Some people may not agree with me, but that's fine. It's a good conversation to have. So, it depends on a person's physical makeup. There's historical trauma, which is kind of the cumulative being of wounding across generations and lifespans. And a lot of that comes from being part of a different group, whether it's an LGBTQ plus, whether it be Native Americans, there's all types of groups that we talk about. So there's a long history of trauma. When you talk about being African American and slavery, that's still very much a part of their life. That doesn't just go away because we don't have slavery anymore. And having talked to many African American people, they really consider that trauma, having to teach your children about the heritage in slavery and help. And some of us can't even believe that occurred in our country as well. So I think also the Black Lives Matter movement, no matter where you stand on that's impacted all of us, hopefully in a way that we're more cognizant. If we are part of, like some people call it white privilege, however you want to frame it. Some people don't like that term, but really I think just making us more sensitive to what other groups, experience as well. So there's triphasic symptomology is really when there's a triad, when it can lead to different things. Some people act out. That's how they manage it. Other people, it's just disassociation. So it really can really change how we look at things. I think I just have a question I want to look at. Nope, I don't. So what are some of the possible implications of trauma? We do know it affects us at a mental, social, emotional, and spiritual level. We do know that trauma takes away structure, stability, a sense of safety as well. It impacts all of us. So mental, it's alterations to memory and effective problem-solving skills. When trauma interferes with our life in that way, it's harder for us to make decisions. And when we can't make decisions, we kind of get stuck. So that's where like life skill training can really help people with trauma. It doesn't even have to be counseling all the time. It just may be that, how can I be a more effective problem solver? How can I, as Jean talked about earlier, how can I learn how to self-soothe? And that's something that we see a lot when we work with schools. How many kids do not know how to self-soothe? And as parents and caregivers of youth, we really want to teach kids the skills as opposed to solving for them. When we talk about social, it's insecure interpersonal relationships, social anxiety and phobias that may really limit our ability to not be isolated. And we do know isolation makes a whole host of issues more difficult for us to manage as well. And I think also too that social anxiety keeps us isolated too. And then if we have that, can we have secure interpersonal relationships? And that, again, that's where life skills training can really be helpful in terms of what are the key elements of strong, positive, meaningful interpersonal relationships. And we may take that for granted. But if we grew up in a household where we were just inundated with domestic violence or child abuse, we don't have secure interpersonal relationships. They may be based in fear. So, we take things for granted, and sometimes we really need to look outside of our own lens and look what other people have experienced as well. Difficulty regulating emotions, anger and depression are common. Anger is usually manifested outward. And I always say when I ask people what anger means to them, I hear a lot what anger, when I express my anger and I'm yelling and screaming, I feel powerful. And when I probe that and ask, well, what's behind the anger? I would say in the vast majority of circumstances, it's a sense of hurt. It's a sense of abandonment, but it's easier to express anger than the vulnerable emotions of being hurt. And when you're a trauma survivor, that is just exacerbated tenfold as well. Spiritual, if all these things are in place, can be feelings of emptiness, loss of meaning and purpose, being very cynical or sarcastic about our life. And again, this ties into just, the inability to have those meaningful connections, being isolated. So being part of a faith-based organization, whether it's denominational or a certain religion, just really makes us feel very supported. I know, just as a sidebar, we have a recovery center, and the people in recovery say that they credit that for not relapsing, for not having a setback, because they're not socially isolated. They're with people that have went down their road. They have, shared history, shared experience, and not being judged is a big, big factor. I'm just checking my time because I feel like and I don't see any questions so far. Where's my time? Good, we're doing good. So post-trauma pathways, individuals respond to trauma differently. Since we all experience it, it's perceived differently to everyone. So, when we do address it in a positive way, that can lead to resilience. And resiliency, we all know what that is, but for me, I think the simplest way to put it is the ability to bounce back. It's maybe the ability to grieve it, own it, recognize it, be upset by it, but then to move forward, as opposed to being stuck at a certain point. And that comes back to each person's individual characteristics. But resilience is so key to being able to move forward from trauma. And the downward growth is the opposite, explains the ability, resulting in maladaptive functioning. And that often can be self-harm, substance use, anger, or violent behavior to people that we care about, or just people that we don't know. So possible risk outcomes this is from the ACE study. It's, and when you look at this, there's just a series of really harmful behaviors, from smoking, which we know people use to cope, and we hear that all the time. Substance misuse and abuse. Maybe you're drinking moderately, but you can't get rid of your negative emotions, or you just keep reliving that negative experience. So what is maybe moderate use goes into misuse and abuse and potentially addiction. Suicide attempts, just not engaging in physical activity. And we know there's so much research that when we are physically active, the endorphins it produces, we tend to be happier emotionally and mentally as well. I mean, missing work, the list is, and I'm not going to go through each one of these, but all of these are just really negative outcomes of trauma when we're not managing it, addressing it, and moving forward in our life as well. The effects on the brain. I always think this is an interesting one. When I do this in person, I always ask this question. It's that, it triggers the brain's alarm of fight, flight, or freeze. And I remember a colleague of mine said, well, I would fight. And I think we have very similar personalities. And I said, well, I always thought I would fight too, but you never know it until you're in the situation. My experience was I saw a dog of mine as a child hit. I could have stopped it if I was able to articulate the dog's name. And I couldn't. So I froze. And it wasn't until after I saw the dog hit and I experienced that trauma that I started screaming. And, that's probably been decades, and it's still very real for me. And I'm hyper alert with my current dogs and streets and cars. So that really lives on with me. It's not incapacitating me, but it's still very much a part of my life, even though it's decades ago. And you may think that's silly because it's a dog if you're not an animal lover. And obviously so many people have got so much more severe trauma than that. And I'm not saying that's just as an example as well. So when trauma is chronic, we really have a decreased cognitive ability to think things through. So that's an increased sensitivity to being in the moment and difficulty managing emotions, impulsivity. Hyper alertness is another big one. And hyper alertness means that you have a kind of hyper reaction to certain events that may trigger those feelings as well. Difficulty differentiating between real and imagined threats. So those are some of the things we see. Okay, there. Oh, let me go back. So trauma and substance use. So 50 to 60% of individuals with PTSD symptoms are simultaneously struggling with addiction. I don't think that's so surprising to many people because it is a way to cope. When we use the substance, and what we hear all the time in our work with substance use prevention is people use it because it makes them feel better. It helps them get through the day or the night. It helps them relax. It is a coping mechanism. Is it a healthy coping mechanism? I'm not here to preach to anybody, but if we have to have that drink every night, you have to just consider, are you at a healthy level or an unhealthy level? And we certainly know that goes from there as well. Childhood trauma, physical and or sexual abuse are 3 times higher risk of developing a substance use disorder than the general public. So that's a really, really big one. I'm not going to read all of them to you because of time. I'm just going to read some of them to you. Women are more likely to struggle with recovery due to high rates of sexual abuse in their history as well. So again, trauma, and then you compound that with substance use or misuse or addiction, and you've got a really complex problem there. And I also think this is interesting that 80% of women in treatment for substance use are trauma survivors. I previously worked in residential treatment with youth that it was like the last step before jail, and they were 14 to 18, sometimes 19. And I would say at almost 100% level, those youth had experienced trauma, mostly abandonment, neglect, being adopted much later in life. So being in, what they called orphanages, but they existed with very little care, a lack of attachment. So all those factors are a big thing too. So let me just see do I have any questions so far? I love that when we are in real time, because we can see if we have questions from the audience. So let me go back. So 8 strategies for trauma responsiveness: recognizing trauma symptomology and its impact, thinking about new employees and their orientation. What are we saying? Do we understand that? Do we do training? I know with our organization, we do trauma impacted training for all our staff. And whether they need it directly, it helps them to sensitize them to what people that we're working with are experiencing as well. Messages from leadership, having an open door policy, eliminating punitive approaches to mistake, looking at mistakes as a learning experience as opposed to, being punitive. And having leadership where they send the message that it's safe to be in the environment as well. Operating from a strength position. I think that's something we've all seen in our world, the nonprofit world, those of us that work with people. And also Jean covered it in her parenting program, where we sometimes have a tendency to comment more on the negatives, like you didn't make your bed, you didn't do this, you didn't do your homework, as opposed to, hey, you did a great job on that paper, or hey, I'm really glad that you got that meeting with whomever. So the strength based as well. Space speaks. What does your space in your environment say? Is it a positive one? Is it an accepting one? Is it a physically pleasing one? That makes a difference to how we see things and to our cognition. Personalize our interactions with all the individuals that we encounter. Be aware of secondary and vicarious traumas I've already discussed. I think am I getting an alert of time? Oh, is it a question? Okay, great. I can't read your writing, so I'll have to look at that. Encourage connections, engagement. This goes back to what we talked about, that when people are socially isolated, the trauma is going to be there. So as we talked about, trauma survivors experience feelings of anger, paralysis, anxiety, and depression. Let's talk, and when we talk about depression, it's turned inward, then we really are concerned about self-harm. We are concerned about suicidal ideation or suicidal act. And I think that a lot of my research, a lot of what I've been learning through webinars and readings is that there's a lot of concern with COVID, social isolation, and the impact it's going to have on our mental health. We know it's having an impact. We all struggle with it to a degree. So, it's really working to change patterns of thought so that negative beliefs about oneself, we can change that. We call it cognitive restructuring, which is really a layman's term, is helping people to learn, instead of saying I'm not unworthy, that I'm worthy, and helping them work through that as well. Again, if we're viewing the world as dangerous, that's a difficult way to live. If we're afraid to go out our door because we think something bad is going to happen, that puts us in a hyper state of anxiety that is really difficult to manage. And that's where sometimes we need help. If we feel that trust and safety are non-existent in our life, imagine, just take a moment, close your eyes, or just think about how would you feel if you didn't feel and had no trust and safety in your life. This is especially true for children if they're in a really harmful house, where there is child abuse, sexual abuse, even and neglect. I mean, we sometimes overlook that. I know we don't, because we're trained. But neglect, it means that we don't know where our next meal is coming. We don't know if we're going to have the same house. Are we going to be living in our car again? Through our Family Success Center, we see that there are people many times are just operating and working from a crisis situation. Don't even know that they are. We may recognize it. So that's where people don't understand that how important our basic needs are. Again, I think most of us on this webinar do, but do the general public? I don't know about that. And the other thing too is we often can push people away. We reject others before they reject you. And that goes back to, we are just repeating what we know. I have one question. I where's my Q&A? I'm told to be looking at my Q&A, which I thought I did. Hold on a second. This is where I'd be interacting with my audience, right? So I had a question about trauma and PTSD. So this is perfect time. Post-traumatic stress disorder is a mental health condition that can occur with people having a traumatic event, witnessing a traumatic event, or being repeatedly exposed to graphic details. We hear about PTSD all the time with war survivors, people that have fought in war. And we know that that is very, very prevalent. But again, PTSD can occur many of us that have experienced some of the things we've talked about as well. And some of the symptoms are experiencing intense, disturbing thought processes related to their experience. As a result, anger, sadness, and other emotions like that, emotional detachment can occur. We can avoidance of situations that may relive that traumatic event, strong negative reactions to ordinary environmental senses, such as loud noises or accidental touch. I know somebody personally that, was in the war and they don't like 4th of July because it reminds them of gunfire. That's something I've never experienced. So it's hard for me to relate on a visceral level, but I certainly can try to relate and understand, right? Empathy is trying to put yourself in that other person's shoes, not saying that you know what they've gone through, but you are trying to understand as well. Many people say when there's severe PTSD, that, that's where treatment is warranted. So people, there's all different types of therapy for that as well. And PTSD, the prevalence, it affects 3.5% of the US adult population. Women are twice as likely as men. 5% of adolescents exhibit symptoms. Girls are more likely to be diagnosed. And many symptoms occur 3 months after the traumatic event. I think I'm almost out of time. Yes. So there are symptoms of secondary trauma, such as physical, emotional, or cognition, which I think we've talked about a little bit. So the physical impact: increased heart rate, difficulty breathing, changes in appetite and sleep patterns, loss of concentration, increased severity. So again, I think most of us probably have experienced this to some degree when we've had extreme anxiety. I know people sometimes think they're having a heart attack and it's really a panic attack where they just can't breathe. So we know the physical symptoms are very real. And sometimes they're very much minimized or not really recognized. The emotional, the effects on the mind. So there's feelings of anger, feelings of guilt, numbness. And numbness is really concerning because if you're not feeling anything, you can engage in any number of really harmful behaviors because you're just not allowing yourself to feel. Hopelessness, when I think we all can say we've experienced hopelessness at some point in our life. And hopelessness can really bring you down a very dark space. It can make you think about ending your life. It can make you think about just walking away from it all. So hopelessness is something that is really pretty significant. Lose confidence in one's professional ability when it starts to impact our life and we can't do our job. Maybe that's when we start to, say to somebody that we love or that we're working with, and maybe you need to talk to somebody, because when it's interfering with our day-to-day function, that's when I think we really need to take that step forward of looking to get some help. Feeling overwhelmed. We all feel overwhelmed at times. Is it a chronic situation? Do we feel overwhelmed one day and the next day we can bounce back, which is what resiliency is? And I think many of us probably can. Some can't. So may begin to repeat negative coping skills to the client. And this is what we talk about when we're working with people. And I'm if I have enough time, which I don't know if I am going to have enough time, we'll talk about the impact of those of us that work with youth, whether we're in the treatment arena, whether we're in recovery, which is not treatment, it's people that have shared experience. And working in the recovery sector at our agency and working with people in recovery, we see that a lot. But it does impact our thinking patterns. So the preoccupation with trauma, it affects our thoughts, our dreams. We can't sleep. And I think we all know that when we can't sleep, everything in life is exacerbated, generally in a negative way, because we're just exhausted. So we have really rigid thinking patterns. We avoid behaviors that, can reinforce the fear. And then the opposite is, perfectionism, unrealistic expectations so that we can just mask that fear and anxiety. And, on the surface, we may look like we're managing everything really well, but we're not. And apathy is feelings of indifferent. Are we truly apathetic, or is that just our coping mechanisms, our way of just holding it off as well? So let me see what time it is. Okay, 10:45. Good. I'm just checking my time. So some secondary trauma, some risk factors, so should professionals work with individuals? It depends on the motives of the professionals. And when I say professionals, it may be somebody doing life skills, it could be somebody doing counseling, but this, really can impact professionals as well. So, I'm just going to move a couple forward because I don't think I have enough time for some of these. Oh yeah, I don't. So I don't. So additional risk factor coping with stress. So emotional-based problem solving versus problem-based problem solving. So it's a tend to change the environment that resulted in that. And it tends to address the root of the problem, which is what we really want. Because if we can address the root of the problem, I think it's much easier to move forward. And emotional based, it's, again, that can be positive, where you have positive coping mechanisms. Again, echo what Jean said about self-care and mindfulness, that we underrate this so often about, what do you do to self-care? And sometimes people don't know. Other times people do. And sometimes we have to help people find out what it is that helps them to what their self-care is. Journaling may help one person or art, others it's exercise. And the negative is the avoidance, the substance use, which can lead to substance use disorders as well. So this is also for professionals. So I'm going to skip this. So, personal maintaining friendships outside the professional sector. Sometimes we have to establish professional boundaries with clients. Again, just from a practical experience, sometimes it's really hard to leave your work behind. And sometimes somebody is really, there may be some transference where what you've experienced, is very much in line with what they've experienced, but having set in those boundaries are really, really important as well. Acknowledge your limits. We all have them, and it's not up to you to create the change. Strive to be the agent of change, because when we try to do other things, try to manage it too much, that's not good either. Practice holistic self-care, recognizing that we're good enough, believing in the therapeutic relationship of whoever it is, whether it's a counselor or somebody that's just helping you through an are not really are not secure in being resilient, and that's just something that we can learn as well, and that every situation can have a positive impact. And I think by acknowledging a client or somebody that you're working with, resiliency, there's so many possibilities as well. And believing that human existence is, it's just part of who we are, and that's just a great thing. So so that's it. So I'm going to see if there's any questions. Are there any questions? I'm going to see up here.
Hi, Karen.
I answered that one.
So, yeah, there's one question here on, do you have any tips to deal with trauma or PTSD in order to heal?
Yeah. So I think I addressed that a little bit, but I'll come back to that. I think something else came. So I think the big issue is PTSD is something that many people can live with, and it's a diagnosed mental health disorder. Sometimes people need ongoing treatment. It depends on the severity. And when we talk about severity, really how does it impact their life functioning? So I think the key is working with somebody and knowing when to refer to a counseling situation or a treatment situation, but also helping them understand the person, that they can manage PTSD, talking to them about resiliency, helping guide them along that path. So I think there's it's a complex question, because PTSD can go from people who live with it every day and manage it fine, and other people it really interferes with their life functioning. So there usually is a continuum. Are there any other questions?
I don't see any here. Does anybody have any other questions? You can type them in the Q&A section. We'll stay on for another minute, and then we'll go on break.
Yeah, and also I know I skipped through a couple of the slides on professionals and how to work with clients, because that was more clinical, but we will put this up there. We'll put this on our website in the next day or two, so you can have that. It really is a different audience. So I didn't want to go into that too much, but that will be in there. And again, you can contact me through Prevention Resources if there's any other questions you have. I would love to have a further conversation, and I wish I could see all your faces. I was talking to Nick before. It's in some ways virtual is harder, because you're just looking at your own face and your own talking. Whereas when you're in an audience, there's so much more interaction, but that's our world right now. And I leave you with this thought, is that, COVID is traumatic for us. And I think the key is talking it through, having a support system, not isolating, which we all can tend to do. And, we can't see everybody we want to see, but as Jean said, sometimes it's a Zoom call, sometimes it can be a socially distanced connection, but we can't underrate the need for we're not meant to be isolated human beings. We are meant to be socially connected. So thank you very much, guys.
Karen, we have another question that just came in, actually two questions.
Okay, I just stopped. Okay, go ahead.
No, it's okay. One person asks, is there medication for PTSD?
There is. I am not an expert in medication. I can certainly answer that question offline and refer you to some clinicians I refer to and work with that manage medication with clients. I do not do that.
Okay, great. Another question, can Karen provide resources or listings of identifying trauma events?
So I'm not sure I understand the question. So can somebody clarify that question? When you say clarifying trauma events, I'm not sure what the question is.
I think they're asking for like where can they get resources to
Okay,
be able to understand how to identify trauma events.
great. So I have several presentations on trauma, and one of them does cover that. So I'd always be willing to speak to you if you have a group or a training. I think there's lots of clinicians that work with trauma on a daily basis at a therapeutic level. That would probably be, I could actually refer you to some that I've learned from that would be able to do a presentation as well.
Another question, how do you encourage your child to go to school if they're afraid?
I have to tell you, that's very common right now. We're working with a lot of youth through our LEAP program, through our EAP program, where kids are resistant to going to school. And I think number one, find out why they don't want to go to school. Don't immediately go the negative and go into the yelling route. You've got to go to school. You're going to fail. You're going to flunk out. The more you yell, the more they're going to shut down. So I think acknowledging the fear, it's very real that today's world, finding out why they're fearful. Is it because of COVID and they're afraid of getting sick? Are there other factors going on? It's always good to scratch the surface. Is there bullying going on? Are they socially isolated? I think, again, be calm, talk to your children, acknowledge the fear, saying, sometimes sharing your own fear that I get afraid sometimes too. And this is what helps me. Do you think you could try that? So I think those are all different things we can try. The worst thing we can do is minimize it, yell about it, and lecture about it, especially with teens, because when you start lecturing, they tune you out. I like to say it once, mean it, own it. But I think fear can cover a myriad of emotions. So I think you have to scratch the surface. I think also too, if it becomes a point where this doesn't work, it's probably always better to just consult with a professional and say, is there anything else you think I can be doing? But I can't overestimate, I want to just really say the talking and the ability to talk it through and being patient, and especially with adolescents are less verbal in general, especially males. So you may not get much on the first round, but I think you just have to be persistent and be calm and be non-confrontational.
And we have our last question. How do you reach people who shut down when trying to talk?
Well, I encounter that all the time with adolescents, especially male adolescents. I think you have to persevere. I like to use the words, you're in control of this, it's your choice. And even though that may not be, I think sometimes it helps reduce rebellion, because especially if they're in a situation where they have to see somebody, or the parents are making them see somebody, or they're in a program and they've been mandated, because it may be an illusion of control, but I think it does help to use those terms, you're in control. And it's your choice. And sometimes you can just really use a lot of open-ended questions or comments like, hey, you may not want to talk right now, but I'm going to ask you to consider something I've seen or I've experienced. You don't want to make it about you if you're in the therapeutic relationship, but you want to just say, this is what I've seen. That's a good way to frame it. I know some friends that have gone through this, and they didn't want to talk about it, but in the end it helped them. And this is how it helped them. So try to give them some real life experiences. So you may have to do a little bit more talking. Again, balance it. Don't become lecturing. But just be calm, be confident, use open-ended kind of questions, and be willing to share some things you've experienced, not making it about you, or some things that you've observed and you have worked. So give hope, be hopeful.
Great. Thank you, Karen. That was our last question. We are going to go on a 5-minute break and we'll be back at 11:25 for our next presentation, Stress and Anxiety Management,
Thank
with our
you.
speaker, Wendy Sidebottom. Thank you, everyone.
Thanks.